Hello everyone, my name is Alexis Darden. This is discussion 1 for INFM625. In this discussion, we were to refer to taking the history on page 9 of the Rational Diagnostic and Treatment book, create a similar scenario for a patient interaction based on our own experience or a hypothetical scenario but close to reality incidents, and also answer the following questions in the scenario. For my scenario, this goes as follows. The doctor, good morning, Mrs. Jones. What are you being seen for today? The patient, I've had constant back pain all day. The doctor, what part of your back are you feeling this pain? The patient then responds, in my upper, middle, and lower back. The doctor then asks, when did the pain begin? When you were doing activities or when you were resting? The patient then responds, it happened randomly. I wasn't resting and I wasn't moving around. The doctor then asks, have you tried to lay down to see if the pain subsides? The patient then responds, yes. Yes, when I went to lay down, the pain was just as bad, if not worse. The doctor then asks, how long has it been troubling you? The patient then responds, since this morning, no medication has helped. For question number 1, we were asked, how can you improve the complaint communication process? Use a new patient and old patient as different scenario versions and update your recommendations. The scenario I used was a scenario based on my own experience at the doctor's office. In responding to the first question on how the complaint communication process can be improved, I think the most important thing is to allow the patient to fully explain why he or she is visiting the doctor in the first place. Typically, in the initial patient-provider interaction, the provider asks what the patient has come in for, just like in the scenario in the book. Usually, the patient is asked a number of questions concerning that initial response, leading to a conclusion that could or could not be what's specifically wrong. In my case, it took several physicians to actually listen to my issues to determine a correct course of treatment and not just give a vague solution. In a new patient scenario, the doctor would allow the patient to state his or her full reason for visiting the doctor's office and ask questions based off of that. Also, in addition to my old patient scenario, it would be appropriate to ask the patient if she had experienced that type of pain before, how frequently she had experienced that pain, what locations the pain was in, and if she had been doing any strenuous activity during the onset of the pain. Based on the patient's responses, tests would possibly have to be run to rule out various possibilities and come up with a correct course of treatment. For question number 2, how can an IT tool help in such a process? Provide examples. In response to the second question, an IT tool could be used to capture the patient's needs prior to an appointment. If a patient has scheduled an appointment, there could be a short form to fill out that addresses the concerns of the patient in detail should the patient want to give a full description. Of course, in an emergency situation, this would still be possible, but just not as possible due to pain-related emergency situations resulting in patients being in the most severe amount of pain, and not being able to focus on filling out a form. When creating an appointment in a patient portal, you're given the opportunity to provide why you want to be seen by the doctor. And you're also given a text box in most cases that allow you to describe your pain and provide any other additional information. However, on some of the patient portals, there is a character limit, so you're not able to provide a full detailed explanation of your symptoms, how you're feeling, and maybe the onset of the pain. So to be able to provide that for patients, if they're using a patient portal, the doctor would be able to review that before the patient is seen. And these are my references. Thank you.